So on the agenda today, we've got Anna Harkley, our Director of Public Health, who will be giving a local COVID update. We've got a roadmap update, and we should have Andrew Vaux from our communications team to give you that update. Then we'd like to have a discussion with you all, please, about what's going to happen after the 19th of July, your thoughts, any concerns and any questions that you might have. And then we will be finishing with Lucy McDonald talking about our Wakefield Ambassador Programme. So over to you, Anna.
Thanks, Tracy. So I'll go through these quite quickly. So just to let me just close my little thing, otherwise I can't see. So just to show you that if you look at the far right hand side of that screen, you'll see that our numbers are really high in Wakefield. So this is sort of hot off the press today's data. It's not validated, but it's 637,000 cases today. And if you look at Barnsley at the top, that's 726.7 cases per 100,000. So Barnsley's above us. Thankfully, we're not the highest. We are the second highest across Yorkshire and the Humber. And I think that's probably for a number of reasons. For a start, we've been the lowest in West Yorkshire for quite a while. So often what you see is other areas kind of getting really high rates, lower rates in Wakefield, but then when it hits Wakefield, we then see those rates go up again. So if you looked at it over 3 months, we'd have kind of lower rates, but it's just about where the peaks and troughs are, if that makes sense. But it's really high. And if you look at our you know, the other factors that we'd look at, like percentage positivity rate, I think that's around sort of 14% now. So again, it's all going in the wrong direction. Next slide, please, Tracy. So just to kind of show you the context around ages, what we're seeing is we're not seeing those high rates in that 80 plus or even 60 plus population, where all of those people that have been double vaccinated, we are seeing that keep rates really, really low. But what we are seeing is a phenomenally high rate in our young people, children, young people. And really, as I've explained before, that's because we don't have any control measures or hardly any control measures in place in terms of government guidance now, because people are mixing freely, and that's the cohort that hasn't been vaccinated. And that younger age rate, although we're doing very well on our vaccinations still, that younger age range won't have had their second vaccination and the 2 weeks that they need in order to create an immune response. So, you know, my real nervousness around this is that although children, it's very, very rare that children have poor outcomes from COVID, but actually through the whole of the first year of the pandemic, only 25 children died of COVID, and given that that's a cohort of just trying to find the data actually, but I think it's 500,000 children. Oh yeah, so here you go. 500,000 children were infected with COVID in the first year. 6,000 children were admitted to hospital. 309 were admitted to intensive care, and 25 children died. Of those 25 children, very sadly, 19 had an underlying chronic health condition. So clearly, while the risk of death overall is incredibly low, those children who have health conditions are more at risk within that cohort. So overall, their risk is very low, but that, you know, they are slightly more at risk. So and I know, and the other risk, I suppose, is around long COVID. So if that, you know, with that many people get infected, if 10% of those people end up with symptoms after 12 weeks, like what, you know, that has a huge impact as well. So it is concerning. Next slide, please. So again, you won't have seen, this slide hasn't looked like this for a while, has it? All those purple. So we've seen it go right down, haven't we? We'd got some wards where the numbers were so low we couldn't even show you them, they were white. And you can see that, again, we've got those high rates and they're very well distributed right across the district. So we're not particularly, we've got these 5 areas, we know we have slightly higher rates where we're doing the door knocking service, but actually you can see from that it's widespread community transmission, really. Next slide, please. So I thought this was really interesting. This was a slide I got from PHE, from Public Health England, Yorkshire and Humber today, and I just wanted to share it with you. So if I just explain it, that orange line is your case rate. So what you can see there, and this is West Yorkshire, what you can see is that back in November, we had a really high case rate. So it was just around 2,500. I don't quite know how they're counting that actually. Oh yeah, sorry, it's right. So you know, we're over 100,000 across West Yorkshire. Now we're to be honest, we're probably there again. So we're probably about as high as we were in November. But if you look at our hospital bed occupancy, you'll see, and that's the blue line, so that's the bottom blue line. you'll see that that is flat. It is going up a tiny bit, like dribs and drabs, but it's basically pretty flat. And if you look at how that was back in November, that hospital occupancy more or less followed the line of the infection rate, and now it's not doing that. And that, again, that is, as I've said before, and I'll say it again, it's testament to the vaccination campaign. Next slide, please, Tracy. Yeah, next slide. So these are some slides that Paul Jakes, who's on the Health Intelligence team, pulled together for me for the CCG AGM. So some of you may have seen them last night, but I just thought they were really interesting, so I wanted to show them to you all today. So in part because this covers like a really long time period. So this is from the beginning of the pandemic to where we are now, and it's just really showing you the shape. So that's your case rate per 100,000 people. What you can see is that where we are now is back where we were in November. So actually, you know, our rates are really high, and at that point I think we were either in lockdown or about to go into lockdown, whereas now actually the government are continuing to lift measures. So from Monday we're going to have more measures lifted, so it's likely that that is going to go higher, that case rate is going to go higher. Next slide, please. And oh yeah, so sorry, just yeah, if you just press on a couple, I think this was just looking at kind of a bit more detail around that. We can send these slides around so you can have a look. Next slide, please. So again, sort of this is a slide that around hospital numbers, and you can see that whilst we had that really high peak in November, that they've remained flat. Next slide, please. And again, you know, similar with deaths, if we look at our deaths right across the whole period of time, because normally I just show you the last sort of few weeks, you can see that we've not, just looking there, 1, 2, 3, 4, 5 weeks of no deaths at all from COVID, and then there was, I think, looks like 1 and then another 3 weeks before that with no deaths from COVID. So again, a very, very different picture from what we were seeing before. Quite interesting to look at the non-COVID deaths as well. So you'll notice that when we had the highest peak of COVID deaths, we also saw the highest peak of non-COVID deaths. That could be seasonal, but it could also be around access to healthcare, you know, people choosing not to kind of ring 999 because they're worried about putting the health system under pressure. Next slide, please. Oh yeah, sorry, they're there, those are, so that's just a bit of explanation from Paul around sort of, so wave 1, 330 deaths, wave 2, 520 deaths. It was smaller, but it was longer, and how that has it has impacted on care home residents, because to be honest, they have all of those risk factors around age and underlying health conditions. Next slide, please. So yeah, so just very briefly, because we haven't got a lot of time, but I just wanted to think a bit about more broadly than just health and care outcomes, and actually look at some other things that impact on health and well-being. So our claimant count, you can see it whizzed up during by 2% during the first lockdown, and we've not seen that go back down again. So those, and that's actually where opening up the economy will help that, hopefully, because you know, if you're in a bar job or a restaurant job or a cafe job, you may well be one of those claimants. So there is a balance around, you know, the well-being impact of losing your job, you know, and contrasting that with the well-being issues around COVID. And it is a very, very, very challenging decision to make, because whatever you do, like so many COVID decisions, whatever you do, it's going to have a negative impact for some groups. Next slide, please. And just really quickly, just showing you a bit around the inequality split. So that top line is Wakefield East, which is one of our most deprived wards, and you can see that there's been a far higher jump in claimants for welfare benefits, etc., in that ward, and again it stayed really high. Whereas Ackworth, one of our wealthier wards, you can see it's been a much, well, probably a lower increase, and also stayed a lot lower and from an initial lower base. So I guess that comes back to that we've all been through the same storm but in very different boats, and that just that recognition really that some communities will have suffered disproportionately from the impact of COVID. Next slide, please. And just really quickly again, you know, we know there's been a huge impact on children's education. Or if you look at, so the blue line is mapped against when the schools have been open, and looking at attendance, and you can see that like it's dropped right down. So we're at 70% attendance, almost 7,000 pupils off school isolating. So that is going to have a huge impact potentially on children's attainment, and we know from other work that's been done that the biggest impact is always on the children who are from the most deprived communities for all sorts of reasons. So it's hugely challenging. Obviously that's going to change. So from the 16th of August, children won't have to self-isolate if they're a contact. So when we go back in September, it's going to look different, but obviously children who are cases, children who are, you know, test positive, they will be off, so there will still be an impact there. Next slide, please. Right, I'll stop. I think I'm on to my other colleague now. So just put any questions in the chat and we'll pick those up at the end if we have time.
Thank you, Anna. We do have one question from Pam saying, are people who are furloughed counted as claimants?
Do you know what, Pam? That's a great question. I don't know the answer to it. I wish I did, but I'll find out and get back to you.
Thank you. And I'm not sure if we've got Andrew Vaux with us. I'm just quickly looking down the participation list, the people who've joined us, and I can't see his name.
Yeah,
I'm here.
Tracy.
Oh, you're there.
I'm here.
Thank you, Andrew. Andrew's one of our communications leads, and he's going to just talk you quickly through the roadmap update. Over to you, Andrew.
Okay, so as most of you will know, that earlier this week the government confirmed that from Monday we'll enter step 4 of the roadmap. So this means that all restrictions are going to be lifted. However, the main message across the district is that, as Anna has just pointed out, you know, the case rates are still high, and we must do all we can to think about the risk we play and keeping others safe. So sorry I was a bit late coming into the meeting, but the reason for that was I was in a central comms meeting to look at sort of key messaging going forward, and what the main points will be included in any of our comms, and subject to sort of confirmation. The strapline we're looking at the moment is be careful, be kind, be safe. Be careful, be kind, be safe. And we're looking at breaking each of those down, about giving people sort of instructions about how they can do that. So in terms of the be careful, you know, think about the surroundings, think about when they may still wear masks, you know, on public transport or in closed environments. The be kind, this is all about looking after each other and you know, realizing that at this stage there are going to be quite a lot of people who are extremely nervous about going back out into the community. They may have been shielding for a long time, may not have gone out, so you know, naturally very sort of anxious about what's happening. So that comes under be kind. And then be safe. That is where we're really pushing the key messages of get tested and get vaccinated. So we're looking at developing those into a suite of communication materials which will be rolled out across the district. Next slide, please. So yeah, just as we said, all restrictions lifted under step 4. So no restrictions on indoor or outdoor gatherings. The caveat on that is the advice is still very much sort of be aware in indoor settings, you know, how close you are to people, how much you mix with people who you don't regularly mix with. And it's just all about be sensible and be safe, really. Weddings, funerals and other life events can now take place without limits or restrictions, and all venues will reopen. There's no legal requirement for table service in hospitality settings, although I do believe, having seen the media over the past couple of days, there are some settings that are still going to be using sort of table service if they feel that's appropriate to keep everybody safe. Face coverings no longer legally required, although there is sort of guidance that suggests environments where you might choose to wear one. For example, as mentioned before, when you come into contact with people you don't usually meet with, or in crowded places. And again, I think over the next few days and weeks, we will see more and more individual organisations looking at the guidance on face coverings and the recommendations. I know Transport for London have already come out this morning saying they're strongly encouraging everybody still to wear them. And I think the local mayors are as well. So that's sort of something we'll probably see over the next few days. And then the 1 metre plus rule will be lifted, apart from specific places, for example, at the border. And then at the bottom, just going back to the key message, obviously, there'll be many people sort of celebrating what's been dubbed as Freedom Day, but we really do need to still be careful, be kind, be safe, and think of others. Next slide, please.
I think that's it for you, Andrew, is it?
Thank you.
You were short and sweet. Thank you very much. We did have a question, Andrew, in the chat about is public singing allowed?
Public singing? Pass. I'll look into that.
That's one we'll come back to then. Yeah, that was Coach Paul, and I'll follow that up and make sure you get a response. Thank you very much, Andrew. So this is one for all of our COVID champions, really, about gauging the mood of the community, because as Andrew has said, a lot of people are calling it Freedom Day, and actually we've had responses from other people where there is a lot of fear about returning back to a new kind of normal. And so we wanted this to be our opportunity, really, to think about and let us know about the general mood, and that includes yourself, your community and your networks, the people that you share information with, your family and friends. And this is your opportunity, really, for you to share with us so that we can help to shape the communications that Andrew does. He always builds on information that is received from your COVID champions. So some specifics are about asymptomatic testing. Do you know if people are taking them regularly, and are they using the results of those appropriately? And the same goes with symptomatic testing. If people are actually taking a test or thinking, well, I've just got a cough and a cold, I'm not going to bother. So this is your opportunity, really, to voice any concerns or questions that you may have. Do we have anyone brave enough to take yourselves off mute?
Go on, I will. I think definitely we've had more people who are fearful about the restrictions lifting than we have people who are positive about it, really. I think a lot of people are still worried about the mask lifting being taken off, and we've even had some of our students and volunteers say, I'm not going to leave the house when it lifts. So there's definitely more fear. And one thing that we have noticed is more people are presuming that the lateral flow tests is a PCR test. So they may have a couple of symptoms or maybe be a bit worried that maybe they've been in contact with somebody and they're only doing lateral flow tests and saying, oh, I'm all right.
Thank you. That's really useful information, Lindsay. Has anyone else come across similar?
I obviously just want to discuss something recently, what I've just experienced. Having a high temperature, continuous cough, loss of taste. I mean, we've always been told that these, if this is the case and you need to get a PCR test, it's not always the case. Having a sniffle or feeling sick, who knows that person could be tested positive. And
do you mean how do you know if that person's had a test? Do you mean, Ravina?
No. So basically what it is, right, sometimes we think, oh, having a sniffle is just a bug, feeling nauseous is just a bug, but that's not the case. I think we should encourage people to actually have the test done regardless of, it doesn't have to be a fever, it doesn't have to be a continuous cough, it doesn't have to be a loss of taste for you to get a PCR test. You should generally, if you're feeling poorly, you should be getting a test done.
Thank you, Ravina. I've just seen a comment in the chat from Amanda. And Amanda, I've just seen your email today. I think you sent it in earlier. So I'm sorry I didn't respond sooner because I've only just noticed it. And we're going to make sure that we respond to you about that. That's a question about fertility. And we have covered that in a previous meeting, and we do have some resources which I will be able to share with you.
Thank you.
And we've got, thank you, love. And we've got a question. Let me just have a look. Val, I know of people that have been in contact with someone who has tested positive but refuses to isolate once they've had a negative PCR test. Yep, that's interesting. Thank you very much.
I think that was a very interesting point from Ravina about the symptoms. I mean, obviously at the beginning, but throughout, I think maybe too much emphasis has been placed on this continuous cough and the loss of taste and smell. And I think it's absolutely right to sort of stress that, you know, whilst at the beginning it was thought those were the mainly maybe the only symptoms, there are plenty more symptoms now. And I think, as Ravina says, it would be, you know, really useful, almost if we could say, you know, if you feel unwell, you should get a PCR test rather than hanging too much on this loss of taste and smell, which I think isn't as maybe as relevant as it was in the beginning.
Yeah, can I just sort of intervene there, please? The reason why I've brought this up is because I've just had this experience in my household. My son was isolating due to a close contact from school. So last Friday, I think it was 2nd of July, he was sent home. Saturday, he started to feel, he just had a sniffle, and he was isolating obviously at home, and he was just feeling nauseous. We didn't think anything of it. We just thought, oh, it's just feeling like that. But because he didn't have any other symptoms, we didn't think to get him tested. Later on in the week, the school obviously asked all the children that were isolating at that time to get a PCR test done before they returned back to school. So for that reason, we had a PCR test done only because the school requested it just before they come back into school. So when I had that PCR test done, my son came back positive. And what really upset me was we wasn't isolating from that period where he had those symptoms. We should have been isolating, and that upset me. And now these past 2-3 days, I have not been well at all, and it's come to me now, and I've tested positive.
Yeah, so Rabina, first, I'm really sorry to hear that. It's just so hard, isn't it, for everyone at the moment as well, because it's been going on for such a long time. Just to give you a bit of background around those symptoms. So it did become apparent a while ago that some people, particularly children, had slightly different symptoms with COVID. So, for example, exactly as you described, they might have had sort of diarrhea or other symptoms that you wouldn't have associated with COVID. And I think the reason why the government didn't change the guidance is because the feedback they were getting is people were already really struggling to understand the guidance, and to add a lot more to it at that stage would have just potentially been more confusing. What we've been doing in Wakefield over the last few weeks is we've been sort of saying to any Wakefield resident, if you want to get a PCR test, just come and get one if you've got any concerns. Exactly why you described, because actually sometimes people have different symptoms from what have been seen as the traditional COVID symptoms. It's a really difficult balance to get between you know, anyone with any small thing coming and getting a test, in which case it's fine for the next 4 or 5 weeks because we've had that agreed with the government, but under normal circumstances the risk then is the system becomes completely overwhelmed and no one can get a test. And also making sure that the people that do need a test, clearly your son and clearly you in this case needed one and have had one. So it is a really, really difficult balancing act. And I think right now, like anyone in Wakefield, whether they feel well or not, can get a PCR test, no problem. But that is likely to change. That may change. We don't know, actually, that may change in the future. So I don't know if that's very helpful, but it just gives you some of the thinking behind why only certain symptoms generally are publicised, not all, because COVID,
yeah.
You know.
What I think in schools, because I work in school, I think it should be, because we get a lot of students who have headaches and they feel tired, and these symptoms as well, apparently.
Yeah, I mean, if you look at the range of symptoms that children particularly can experience, and that's a whole really interesting thing about children, because if you've got children or you know children, what you'll find is sometimes children will say they've got a tummy what you find is they'll say, I've got a tummy ache, because that's something they can describe. They might not have a tummy ache, they might be feeling poorly generally, but that's something they'll say. So the way children describe symptoms as well is sometimes different from how adults would describe them. I suppose that it's such a challenge with COVID, isn't it? And that's why we're doing whole school PCR testing for some schools where we know we've got high rates. We're literally PCR testing the whole school to try to find those cases. But it is really challenging. And I don't, like you say, you know, you may have someone as well who and we've all heard of those people. Some people don't have any symptoms, do they? And some people just get a headache. And I know loads of people who've said to me, do you know what, Anna, I felt absolutely fine. And then I took a bite of my favourite chocolate bar and I couldn't taste it. And I thought, that's weird. I must have COVID, and went to have a test and was positive. So I guess that's why we're being so careful at the moment, and we're just trying to test everybody so that we can catch those cases. But it is really difficult because humans don't always fit like a perfectly defined kind of case definition.
Thank you, Anna. I'm just conscious of time, and I don't know, we've got quite a few things in the chat, and I want to give everybody an opportunity to have the voice. But next week we will have a monthly meeting. It's not a normal champion meeting which we have every other week, but once a month we have an hour-long extra one. And I think it's really important that we look at all these comments and give people extra time to think about responses and get back to us. So we will do that. We're not just cutting you short. We will continue to look at all the comments that we've got. We've got one here from Haley about working with blind and partially sighted people. The majority are over 70 and therefore all double vaccinated. Great job. The vast majority of people can't wait to go back to social groups and events because they've been isolating for so long. And the issue that we have is resourcing things from a volunteer point of view. So thank you for that, Haley. That's important to know. And there is a session taking place on Thursday the 29th of July at 10 o'clock via Teams, and I've done this myself, and it's really excellent training, and it gives you lots of information. So we will look through all of these comments. It's difficult for me to scroll just at the moment, but we won't forget about it. And what we want you to think about also, please, is about Champion's role with supporting people to make their own personal assessment of their own personal safety. And is there information that you require from us? Is the support that you want from us to help you to be able to do that? So I know we're kind of asking you lots of information in a very short space of time, but we will revisit. Does anyone else have anything that they would like to contribute before we move on to our next set of slides?
Yeah, can I talk about the lateral flow test?
Yes, certainly. Is that Gillian?
It is, my love, it is.
Hello, Gillian. Off you go.
As you know, I've been trying to get hold of lateral flow tests for many, many vulnerable families that I support, because they're having difficulties walking into their chemist without being questioned why they need them. Many haven't been able to access them on the internet because they haven't got the internet. I did request to Public Health that I could actually get a load and actually hand them out, because I'm doing lots of activities, and I was told the answer is no. But if we try to convince these families to actually test themselves on a regular basis, and we're not actually giving them the lateral flow test, or we're not telling them about where they can get the PCR test, because there's lots of information out there about going and getting your vaccine, but I haven't found much information about the PCR where I could actually put it out for families to go. That's a massive issue. And the other issue is, as many of you are aware, because I keep putting it up on the message board, is these families are absolutely petrified of their disabled children getting this COVID and passing away. And they just want a bit of clarity about if they're going to get the vaccination, because Contact, which is the biggest disability organisation, has actually gone out and said to families, you now can go to GP and demand this vaccine, and here's a template to say you have the right. Well, many families have done that in Wakefield, and as you can imagine, they haven't had a good response. So I need to know who I'm supposed to go to, because we support over 600 vulnerable families.
Thank you, Gillian, for raising that, and that's something that you have raised in the background. Kerry, I don't know if you've got a response, because I know you've said you had no problem with tests for Gillian and Kids Aware. I think that's something that we were looking at.
Yes, it is, and I do know that some of the information where I thought you could get lateral flow tests have been passed on to Gillian, so I'll pick that up with Gillian outside of this meeting, because I think obviously that should be okay. So I'll pick that up with Gillian outside to work out what's happened there. And just to come back on that, on the vaccination of children, I think we've had some clear statements that we will reiterate on the WhatsApp thread, and we'll send that out maybe on the email at the end of today. And I think it's really difficult because we have to follow national guidance at the moment, and it'd be good to get some feedback of some actual examples of where people have struggled to have those conversations, so that we can pass those through to the CCG. Would really appreciate that. I think just to wrap up this bit, Tracy, it'd be really great if people could ask their community contacts some of these questions and come back next week, and we'll have a little bit more time to go through and to pick up some of the feedback individually. You know, from what you know, that would be really helpful for us.
Yeah, thank you very much, Kerry. And details of where to get PCR tests are on the council's web page, but we'll look for that link and resend it. So thank you very much. Please do keep sending your messages in. I know we've had a couple of people have to leave because it's just a 30-minute one today. So we'll whiz on, and just a couple of slides here that has been circulated, some new resources for children and young people. Thank you very much, Gillian, for forwarding the Knowledge and Library Service link for us, which is excellent, which we'll share. And there is also an excellent YouTube clip for young adults, really. And the link at the top is for the full video. It's only a few minutes, but then it's broken down into little cut downs, which is just snippets of information that are relevant for clubbing, dating, family, etc. The CCG is asking for young people to record their experiences of going for a COVID jab to encourage others to take up the vaccine. And if you'd like to participate in that, there's an email address. And they would also like to identify young unvaccinated people who might have been ill with COVID, so that they can talk about their experiences too, because we find that sharing personal experience is much better than hearing stories from people that you don't actually know. So I'm sorry we've not got an awful lot of time left, but we'd like to welcome Lucy McDonald to just talk quickly about the Wakefield Ambassador Programme.
Thanks, Tracy. Hi, everyone. Yeah, I will be quite quick, and I can obviously attend kind of any future meetings, but essentially I'm Wakefield Place Manager, and I look after activity that will help make Wakefield become a better place to live, to work, to visit, to study and to invest. As you can see in just these photos, you know, we've got a lot to shout about. We've got some beautiful places, we've got some huge cultural assets, we've got great connectivity, and we've really got a lot going for Wakefield. So if you move on to the next one, Tracy. So because of that, we've created the Wakefield Ambassador Programme, and essentially we need you guys as well to come on this journey with us. So this will help raise the profile of Wakefield. It will help change perceptions of Wakefield as a place. You know, we really feel that the perceptions of Wakefield and the reality of the place are quite far apart, and that, you know, Wakefield's got a lot that people don't know about. So we want to celebrate our success. We want to pull success stories out of our businesses, out of our communities, and shout about these on a regional, a national, and even an international scale. You know, we feel we've got a compelling story to tell, and it's about how we do that will help us attract investment. So when, you know, if Wakefield becomes better known, people have changed perceptions, we're going to attract new businesses here. Those businesses are going to bring new jobs, more jobs, better jobs for Wakefield residents and visitors that are spending money in our cafes, money in our restaurants, all these types of things. And all of us are ambassadors for our place, whether we realise it or not. So with people, you know, you might bump into somebody on holiday, they might ask where you're from. I have this idea that I think a lot of people from Wakefield would say they're from just outside Leeds, and I want to change that, and I want people to say they're from Wakefield. It will help build civic pride, especially as we look at our pandemic recovery. We want people to feel proud of Wakefield, us coming together as a community, and just really shout about that. On to the next one. So we did some place work, we pulled out some key messaging, and one of the big stories is that we dare to be different. We do things a little bit differently in Wakefield. We're creative, we're a little bit quirky, and we like to do things our own way. On to the next one. So some of these kind of key messages that we want to get circulated and get people to understand and celebrate our successes with are all around creativity, connectivity, the beating heart of the UK. If you're to look at a map of the UK, Wakefield is exactly where you would draw the heart. And we like to really play on that, especially with our kind of Yorkshire spirit and Wakefield way. And there's a lot here to be explored. So we've got a lot of messages that we want to get across to people. Next one. So I guess what's in it for you guys, you'll get to learn about what's going on in Wakefield. You'll be able to share your key messages, direct people to share theirs, share other things, extend your network within the district, provides a platform for you to share your story, whilst all creating a better future and legacy for the place that we all choose to work and live. You'll become a part of Team Wakefield. You know, we're all in this together. We're just growing this ambassador program. And down the line, for those who are interested, there may be speaker and profile opportunities that we'd reach out to our ambassador network to look for. Final one, I think. So then just how to get involved. If you have Twitter, we have a ambassador account, which is One Wakefield. We also have a group on LinkedIn. We will be expanding these channels. We're just only getting started, so we're focusing on those two because initially we started with the business community. We share content using the hashtag One Wakefield. We have virtual events. We've got the next one on the 21st of July at 10 a.m. I can circulate that link, and anybody that's interested, come and join. There'll be Rush Bond, the developers, talking about what we're doing with the Civic Quarter and the city centre. There'll be the Hepworth talking about the 10 years that have gone and the 10 years future for the Hepworth. And we'll also be talking about Wakefield's UK City of Culture 2025 bid. And also, we just encourage you guys to engage, share stories you pull out from the communities, from the work that you guys do, and let's amplify those great messages. There's my email, or there is a Place Brand email on there. But do get in touch. Would absolutely kind of recommend joining one of these sessions, joining on social media. And I'm happy to come and talk about it in a bit more detail or answer any questions. But yeah, just get in touch if it's something you'd be interested in. Thanks, Tracy.
Thank you very much, Lucy. Does anyone have any questions for Lucy? No? Well, thank you everyone for being involved this week. I know we've given you a lot of food for thought. The questions that we're asking of you and your communities will be on the follow-up email later today, and we will look at all of your comments and respond to them. We all wish you a speedy recovery, Rabina, and hope to see you all next time. Thank you ever so much to our speakers and to all of you for taking part. Have a good day.